HHS is comprised of a variety of different sites and a very diverse population, but within that diversity we all have times where central line is used.
Central lines are basically just a larger IV that goes into the blood. We need them for giving the antibiotics that cure infections that I treat, but if not managed properly they can make the patient even sicker, so we have to be really careful with them.
So central line infections are one of those things that are actually avoidable. It's one of those things that can be changed or altered, prevented by the practices that our frontline staff perform. Won't matter whether you're a patient in critical care, whether you're in a hematology unit, or whether you're on a medicine unit. The approach to care will be the same, and it will always be based on best practice.
We're creating a standardized toolkit so that everybody's doing things the same way from the time the central line is put into the patient until it's removed. Maintaining the line, reassessing the line, accessing the line, those things are a bit variable, and by standardizing the technique, then we can make sure everybody's doing it exactly the same.
Research shows that each one of those components individually really don't make a difference, but when you bundle them all together, it is significant. And so things like checking the dressing daily to make sure that it's dry and intact, making sure that you label your tubing and your dressing so that you know when they were last changed, making sure that you discuss on a daily basis the need for the line.
Are we still using it for blood work or IV antibiotics?
At this point, yes.
The evidence changes over time, and it's important for us to keep up with the evidence. In an organization where we have multiple clinical units, it's very difficult to do that in separate pockets or in silos. So having one standardized approach will help us to ensure that we're always applying best practice every time. At Hamilton Health Sciences, we're one of the first, if not the first, across Ontario and perhaps even Canada to look at what our rates of central line infection are all across all of our clinical units.
Not only are we creating the policies, we've purchased some software that's going to allow the auditing process to be quite simple, and we're going to be able to track and make sure that we are sustaining the changes that we make.
This job is a big undertaking, but I think it's hugely important, and once we have a system in place, then we will be able to really benefit patients.